So hello everyone, and welcome to the COVID Community Champions meeting. My name's Tracy, I'm a community development worker in the team. And as usual, I'll share my screen with you. So welcome to the meeting. The meeting is being recorded and will be shared on social media. So if you don't want to be recorded, please keep your video off and your device on mute. And feel free to leave any messages in the chat. My colleagues are going to help with that. We will start. Here's the agenda. As usual, our Director of Public Health will give a local COVID update. We will also have a vaccine update on where we're up to. And hopefully we should have Geraldine Fletcher joining us from the housing team. We will have a couple of slides about Mental Health Awareness Week, which is next week. A reminder about the elections and opportunity for questions. So I'd like to welcome Anna.
Thanks, Tracy, and welcome everyone. Got a small select bunch this week. I'll just start sharing some of the data with you. So next slide, please, Tracy. So just to show the slide that I think you've seen the slightly updated version, and you can just see that right to the right-hand side of that slide, we can see those numbers starting to sort of edge up again. So where they were really reducing quite quickly, we have seen a bit of a rise, and that is really to be expected given the fact that the measures have been reduced. We would expect to see some increase in infection rates. I think the thing about Wakefield as well is because our rate was always quite high compared to the rest of the country, so about 3 times what the UK average is. It would have been surprising if we'd seen the numbers continue to fall once people started to mix more freely. So just to show you that in the sort of geographical context, so I think unfortunately the most recent data has shown Wakefield sort of edging up, and I think we're now the 4th highest rate in the country again, which is nothing like where we were sort of 6 months ago, where we were running such high rates. It's still still well under 100. I think we're about 60, but we obviously would rather not be there. And you can see from that slide how Wakefield has gone up that little bit from 52 to 56, and now I think it's been stable at 60 for a few days, like the sort of most recent unvalidated data. But again, the case rate in our over 60s is very low, so you can see it's 9.2 per 100,000. So that's really a far more important metric in some ways than the overall case rate. And our positivity rate is still really low at 2.5%. So yeah, just to always show you this, just a quick slide just to show you that our testing is in line with the West Yorkshire average, and our positivity rate is also in line with West Yorkshire average. So just again, I think we look at this slide every week, but it is really, really fascinating because it's just so obvious to see where the vaccination programme seems to have made such a big impact. And you can see with that 80 plus age group, we're down to 6 per 100,000, which, given that some of that cohort won't have been able to have the vaccine because for various sort of health reasons, that is a really impressive. It's so impressive to see the case rate go down that low. And then instantly you can see in that group that hasn't all been vaccinated yet, so that 25 to 59 age group, that it gets a lot higher. And we see that right through to that younger age group, then those much higher rates. But what we do know is that we are now vaccinating through the age group. So I think 40 pluses have now been invited to be vaccinated. Can't remember off the top of my head, but I think we're around something like 20% of that younger age cohort, because potentially they're clinically vulnerable or for other reasons, have started to sort of. We've also seen that vaccine rate creep up at those lower cohorts. So we should hopefully that should then see a reduction in the in that case rate over the next sort of weeks and months. I suppose the only sort of slight concern on the horizon, which you'll have seen in the press, is that if a variant were to arise that wasn't currently vaccine preventable, that would be a concern. But at the moment there are no particular concerns around variants, and Public Health England are keeping a very close eye on what's happening there in terms of any new variant arising in the community. And also you'll have seen the news that the vaccination also does prevent infection as well. So it's there was some early questions about, would it just be that if you were vaccinated you were protected but you could still pass COVID on? Well, it now looks like that risk has been significantly reduced. So again, you know, this picture just demonstrates so clearly how much our rates have reduced. Those white areas are areas where they're too low to actually show the rate without it being a risk of breaking health confidentiality. So, you know, nothing really concerning there, and we obviously hope to see seeing more of those white areas in terms of numbers that have been suppressed over the next few weeks. And again, just the bubble diagram, but again, you can see how workplaces seem to have become less of an issue. We've seen you can see those education circles are bigger, which again, with children all going back to school and also picking up, previously some of those infections would have been, they wouldn't have been discovered, they'd have been asymptomatic, and now because of the lateral flow testing, we are picking up more infections in that age group. So, but this is the sort of really important stuff, because whilst, you know, in a sense, it doesn't particularly matter if you contract COVID. What does matter is if you become very ill or die. So we see that we have these high levels of infection, still higher than we'd like. However, that isn't translating through into admissions, and that's the really important thing to hold on to. And again, our deaths, you can see they've gone right down, and that's brilliant, and that's just fantastic, and that's just testament really to the success of the vaccination programme. So, but just to sort of finish off with some slides that I haven't shown you before, and we've shown you previous similar slides, but we've just updated the public health team have just updated all this data. And you can see that we know, I mean, all of us know that COVID hasn't impacted everybody in the same way. And you can see there that, again, in our most deprived areas, that we have a much higher rate of infection than in our least deprived areas in terms of hospital admission, so that people who in those areas who have become infected with COVID have had poorer outcomes. And then if we look at our next slide, Tracy, you can see again that inequality gradient around mortality and so deaths is also very stark, and that is very, very sort of very hard, I think, to see that, because it's just so unfair. So what we can see there is that our most deprived populations have really taken the brunt of those COVID deaths, and you know, we do really need to reflect about how we support those communities through the next stage. So this is an interesting slide the Health and Intelligence team have done. I'm going to try and do it justice and explain it, even though I find it quite difficult myself to explain. So the top slide is dated 16th of November to 14th of February. So that's prior to the vaccination campaign really taking hold, because we started that, you know, I think just after Christmas, maybe just before Christmas actually. And then the second table at the bottom of the slide is 15th of Feb to the 26th of April. So this is when some of those cohorts had been vaccinated. And what you can see is how, so the top one is the population. So that's how the population is spread across Wakefield district. So, you know, let's start at the bottom. So about 5% of the population is age 0 to 4. And then your second rectangle down is around your positive cases. So these are people who were getting infected with COVID. And you can see that in that top slide, that's fairly similar to your population demographics. The third rectangle down is your hospitalizations, and that's where on the top graph you can see straight away that if you were of that older age group, 75 plus, then nearly half our admissions were in that age group. If you add your 65 plus, then nearly 2/3 of admissions were in that age group, with almost no admissions at all for children. And then if you look at deaths, you'll see that's even starker. So then you'll see that over 80% of our deaths were from the 65 age group, and I expect if we looked at those under 65 deaths, many of those would be linked to underlying conditions. So those are the 1 to 9 groups that were prioritised for vaccination. So and you can see when you go down to the next chunk on that slide, that you've then got that real shift in sort of hospitalisations. So you're having far fewer older people hospitalised. when it comes to deaths, you're still seeing those older people that have been hospitalised tend to die more than the younger cohort. And what I must ask the team to do is put some absolute numbers on those, because we know our deaths have reduced down very, very significantly. But I suppose it's just a really interesting snapshot of how vaccination changes that population, changes the way populations are admitted, or the people that are admitted to hospital, less so when it comes to kind of mortality, because again, you are far more at risk if you're in that older cohort. So although less people will be getting admitted, the percentage of those who die will still be in that older cohort. So I think we'll pick up any questions probably later on, unless anyone's got any burning questions they want to ask me now about the data. Can't see any hands up. I might have to leave a bit early today, actually, so you might not get the chance to ask me another question, but I think we've looked at that data so often, I think it's probably pretty self-explanatory. Thanks, Tracy. I'll hand back over to you.
Thank you. I don't know if Emma's just going to give us a quick update on the local vaccine situation.
Yeah, I can do. Thanks, Tracy. So at the moment, we can see that we've vaccinated over 182,762 of our Wakefield residents with their first dose of COVID vaccination, which continues to be a phenomenal effort. And we now have reached almost 75,000 people to have received their second dose, and we'll see that figure grow and grow in the next few weeks. And we have 40.6% of people vaccinated so that equates to just over 40% of our resident population being vaccinated with both doses, which again is really, really good. And we have started to vaccinate our 40 years and above age groups from a Wakefield perspective. And we can see here that it's reported that within the 45 to 49-year-olds, we've vaccinated 71.6% of those. And to think that vaccine offer was probably only in the last 6 weeks to that age band. So I think that just shows you how quickly we can make that progress from a Wakefield Place perspective. And I know overall we've vaccinated 63% of our Wakefield residents with first dose COVID vaccination. And I just want to put that in context to some of our seasonal flu vaccination, where we don't kind of achieve that in our flu at-risk groups. Largely our flu at-risk groups sit around anything between 54 and 64% on a good year. So I think that just reflects sort of how well we're doing with COVID vaccination generally, and really want to keep that momentum going for our Wakefield residents, because as Anna said, the vaccination programme is one of the ways that we can kind of start to see light at the end of the tunnel and lifting our restrictions. And with the evidence recently around vaccinated individuals reducing the transmission of COVID to others who are unvaccinated is really good news. But with that good news, it does mean that we still need our younger age groups to be vaccinated, because those individuals who are younger may actually pass COVID on to the older age groups who the vaccine may be not offering full protection to. And this is why that although younger age groups may not be affected by COVID, the disease, it's more the likelihood that they might pass the disease on to their older relatives and family in their social groups. So I think that's a real reason for our younger age population groups to really embrace the COVID vaccination as our older age groups have, so that we can continue to see that level of protection within our Wakefield residents. Thanks, Tracy.
Thank you. We should have Geraldine Fletcher, a housing officer, but I'm not sure that I can see her on the participant list. I guess I could read these out and ask Geraldine to come back if there are any questions. Does that sound like a sensible idea? We're going to share the slides anyway. So Geraldine was part of the housing advice team, and the focus there is about housing needs, obviously, with prevention of homelessness and also early intervention to help people to presumably not be homeless. And the service provides support to people across all tenures. That's whether you're in a rented apartment or mortgaged property. And the team offers assistance and advocacy with lenders, landlords, and offer representation in courts as well, which I didn't know about. They can signpost and refer to other agencies, help maximise income, help with budgeting, and support people to get grants through the Homeless Prevention Fund. So it looks like the scheme has changed, and some of the things that have changed is the government have put things in place to help families during the pandemic, but these measures will be coming to an end. And at the moment, landlords have to give longer notice and evictions have been put on hold, except in the most serious of cases. And the housing team are expecting this to change on the 31st of May when the regulations end. So they want people to act now to take advantage of the team and the council's help that we can provide. So there are a few phone numbers there and some email addresses for the housing team. It's really sad that Geraldine wasn't here on the call, but hopefully if you've got any questions for the housing team or you need any support, you can get in touch. As usual, we will send out the presentation with the links on. We also have some slides about Mental Health Awareness Week. I'm not sure if any of the other team members want to say anything about that, but Mental Health Awareness is the week's 10th to the 16th of May, and there are a couple of really useful websites. Every Mind Matters, which is the NHS website, has got a wealth of resources. I think they've got a quiz as well, so you can take a quiz to see how stressed you are, and it gives you some ideas about how to reduce stress and anxiety. It's a really good website. And then there is also the NHS 1U. And some people may know that as part of my role, I also facilitate a positive mental health network. And for the last 3 years, we've promoted positive mental health during Mental Health Awareness Week by using postcards. Last year, we had to do virtual postcards using social media, but they were brilliant. And actually, one group of people actually did a singing postcard, which was fantastic. And you can see those postcards on the local story website. I will send you a link for that. So this year, the theme is about the environment. So we're encouraging people to write, paint, draw a special message on the postcards, and there's a picture of it. And you can either send it to a loved one or hide it somewhere for someone else to find. And we're also asking people to do crafts. We've got quite a few craft groups that are members of the Mental Health Network. So asking them to leave things, knitted hearts, painted pebbles were quite popular last year. People painted just pictures or positive words or messages on pebbles and left them for people to find. So please be respectful of privacy and mindful of the environment, but do join in our postcards project if you can. And a supply of postcards have just been sent yesterday, and they will be going to all the libraries within the district, so you can pick up a supply from your local library. I think this one might be Neve. A permanent COVID-19 test site has moved. Is this something you can talk about, Neve?
Yeah, so basically we've just put out some communications because the permanent COVID-19 test site that was at Wakefield Waterfront has now moved to the former Westgate Station car park. So there's just some information up there. So the site is available for those with coronavirus symptoms, and you can get an appointment by visiting that link or calling 119. So it's basically there wasn't any loss of testing capacity. It was a smooth takeover from Waterfront to the Westgate Station car park, and then there's just the list of all the symptomatic testing options now. So there's the new one, and then continue to do them at Castleford swimming pool, and then there's the mobile testing units which move around the district, like as and when capacity is needed in different areas. But there's information on our website if you visit the coronavirus information page and then click on the link getting a test. The testing options are always up to date on there. So yeah, that's everything.
Brilliant, thank you. And a reminder that election day is tomorrow, Thursday the 6th of May, and polling stations are open between 7 and 10. And what to expect: social distancing inside and out. The polling stations may be set out differently this year from what you're used to, and there will be a limited number of people, and you will be asked to wait your turn, please, before entering the station. Masks will be worn by staff and voters, so please do remember to take your mask when you go and wear one if you're able to do. And please, can you bring your own pen or pencil? Pencils will be available if you don't have one or if you forget to take one with you, but just for safety, please do try to remember to take your own. Hand sanitizers will be available on entrance and exit, and touch points will be regularly cleaned. And we have a little bit of time, I think, we're just over, but if anybody's got any questions, please do ask now, or you can email them to us as usual.
Oh, Geraldine is with us from housing now. Oh, Geraldine, sorry, I think we unfortunately we got to your bit a bit earlier. So Tracy's been through the slides, but I don't know if there's anything, Geraldine, you wanted to sort of add, or if anyone on this call wants to ask Geraldine any questions about the housing policy.
I'm very sorry, I had IT problems. It just would not let me join. It would not join. So I do
problem at all. So
it's nice to see you, Geraldine, so we know what you look like.
So in your absence, we did go through all the slides. It was very helpful, thank you. And obviously it's a key issue for health housing. So I can't see that anyone has got sort of any questions, but I think they're just... Yeah, sorry, go on.
Sorry, I think there was just one question earlier on. Just to say, do you think it may be possible to give the 50+ age group their booster jab from September and their flu jab at the same appointment to increase take-up of flu jabs?
Emma?
Yeah, I mean, that's a very good idea. I think the thing is we need to wait for the clinical evidence, because people will be familiar that currently you have to wait 7 days between your flu vaccination and your COVID vaccination. So if the current guidance stands and that gap of time is required, then it wouldn't be able to happen at the same time for those reasons. So I think we just have to watch the evidence and the emerging evidence base around whether the both vaccinations could be given at the same time. But in practical terms, it really does make some sense. But that's all I can provide at the moment.
Yeah. And then I was just going to ask a question for Geraldine, actually. Geraldine, I don't know how much you know about COVID champions, but basically we're in a really great position that we have loads of people on this call. Not only the people on this call, but they have a whole load of networks and kind of, you know, ways into the community, and lots of kind of, you know, social media presence. I just wonder, from your perspective, have you got any asks of this group, you know, anything that you would want them to be doing in terms of potentially passing information back to you or passing information out to the communities they work with?
Well, Sarah's just asked a question in chat as well, which ties into this a little bit, is the current guidance about evictions. So evictions have been happening during the pandemic. They were on hold for quite a long time, and most evictions are stayed until the 31st of May. So the end of this month, most evictions have stopped, except in the most serious of cases. They've been allowed to go in very serious and social behaviour cases, or cases where very serious levels of arrears have accrued and it's causing the landlord hardship. But from the 31st of May, we expect that restriction on evictions will lift. And as we've seen nationally, we've got a massive increase in the number of people who have been suffering with financial hardship, people who have accrued arrears. Housing associations are saying they've 30% more people in arrears than they had at the start of the pandemic. About the same number of landlords. Also, landlords are looking now to sell up because they've suffered hardship during the pandemic, or because the property market is quite buoyant at the moment, so they're looking to take advantage of that. So look, we are looking at a period of we feel there's going to be a period of increase in homelessness and concerns for people. So what I would like is for your champions, the people going out there, is to make sure that if people do have concerns, if you're speaking to people who are raising those issues, if you're speaking to people who know of people who are having those issues, to tell them to get in touch with the council as soon as possible. There are lots of things that we can do if we know about the situation early on. We have access to services, we have access to funds. we have access to partners who can provide other services. It's really, really important that we start acting now to prevent what we see as a possible tsunami of homelessness after the 31st of May. And I can put some, oh, sorry, from Lindsay, yeah. I can certainly put some information together if somebody wants to. I've got an email address, okay, thank you. So I'm more than happy to send out or speak to any groups, or speak to individuals who have concerns. Please do get in touch with us. It's really, really important that we start dealing with this now. I mean, the government recognised the position that people were going to be in as a result of the financial hardship they were suffering, which is why they put the hold on things. But eventually things will start moving again, and we need to be on top of it. We need to be getting out there and speaking to people. So if there's any questions.
I don't think we've got any more questions in the chat, but Geraldine, thanks. That's very sobering, but also something that we do. At least people do have a mechanism now that if they do discover that, they can sort of signpost those people to the right place. I think the worst situation, isn't it, is when people just turn up, having had you've had no prior warning at all. I don't think people are aware of all the stuff the council can do to support them financially to avoid them being evicted. But okay, so Tracy, have we completed our agenda now, or yeah?
We have, yes. That's all the slides that we've got for you this time. Yeah, bang on time.
So as always, thank you ever so much everyone for attending, really appreciate it, and we'll see you next week.